Epsolay 5% Topical Cream Keratolytics, topical, is a medication that is commonly used to treat mild to moderate acne. It works by reducing the amount of acne-causing bacteria and causing the skin to dry and peel. In addition to acne, some brands of this medication are also used to treat a skin condition called rosacea, which can cause pimples and bumps on the face. It's important to check the ingredients on the label, as the manufacturer may have changed them, and products with similar names may contain different ingredients meant for different purposes. This medication should be used as directed by your doctor, and it's important to follow the recommended daily dosage and optimal timing for the best results. Be sure to talk to your doctor about any concerns or questions you may have about using Epsolay 5% Topical Cream Keratolytics, topical. Before you start using Epsolay 5% Topical Cream Keratolytics for acne, check if you are allergic to it by applying a small amount to a small area for 3 days. If you have an allergic reaction, stop using the product and get medical help. If you don't have a reaction, you can use the product. There are many benzoyl peroxide products available, and some may require a prescription. Consult your doctor or pharmacist on the best choice for you. If using over-the-counter, read and follow all directions on the package. If your doctor has prescribed this medication, use it as directed. If using this medication for acne, apply to the affected areas once or twice a day. If using for rosacea, apply to your face. Avoid getting the medication in your eyes, nose, mouth, lips, or on broken skin. If using medicated pads or sponges, apply to the skin once or twice a day as directed. The dosage is based on your medical condition and response to therapy. Improvement is usually seen after 3 to 4 weeks of use, and maximum benefit after 8 to 12 weeks of use. Do not increase your dose or use this drug more often or for longer than directed. If your condition lasts or gets worse, get medical help right away. When using Epsolay 5% Topical Cream Keratolytics, you may experience skin reactions such as peeling, itching, irritation, and reddened skin, especially at the beginning of treatment. If these effects last or worsen, consult your doctor or pharmacist. They may recommend using smaller amounts of the cream or using it less often. Remember that the benefit of using this medication as directed by your doctor outweighs the risk of side effects. Most people using this medication do not have serious side effects. Although very rare, seek medical help if you experience symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. Keep in mind that this is not a complete list of possible side effects, so consult your doctor or pharmacist if you notice any other effects. Before using Epsolay 5% Topical Cream Keratolytics, make sure to inform your doctor or pharmacist about any allergies you may have. This cream may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. Also, be sure to inform your doctor or pharmacist about your medical history before using this medication. If you are planning to have surgery, it's important to let your doctor know about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Using this medication may make you more sensitive to the sun, so it's important to limit your time in the sun and avoid tanning booths and sun lamps. Make sure to use sunscreen and wear protective clothing when outdoors. If you do get sunburned or experience skin blisters/redness, make sure to inform your doctor right away. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. Additionally, it is not known if this drug passes into breast milk, so make sure to consult your doctor before breastfeeding while using this medication. It's important to be aware that Epsolay 5% Topical Cream Keratolytics, topical, general may interact with other medications, potentially affecting how they work or increasing the risk of serious side effects. This is not an exhaustive list of possible drug interactions, so it's crucial to keep a record of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. One specific product that may interact with Epsolay 5% Topical Cream Keratolytics, topical, general is dapsone, which is used on the skin. Be sure to discuss this with your healthcare provider. If this medication is accidentally ingested, it can be harmful. It's important to seek immediate medical attention if an overdose occurs, especially if the person is experiencing severe symptoms like loss of consciousness or difficulty breathing. In the U.S., you can contact your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's essential to keep this medication out of reach of children and pets to prevent accidental ingestion. Be sure to store it in a secure location and dispose of any unused or expired medication properly. Make sure to keep up with your regular medical checkups and any appointments for lab tests. This will help to monitor your progress and make sure the cream is working effectively for you. It's important to stay consistent with these appointments to ensure the best results from using Epsolay 5% topical cream. If you forget to use Epsolay 5% topical cream on your regular schedule, just use it as soon as you remember. But if it's almost time for your next dose, then just skip the missed one and continue as usual. Don't take double the dose to make up for the missed one. And remember, always use it at the same time every day. When it comes to storing Epsolay 5% topical cream keratolytics, it's important to keep it at room temperature. Different brands may have different storage needs, so be sure to check the product package for specific instructions. And remember to keep all medications out of reach of children and pets. When it comes to getting rid of any expired or unused product, it's important not to flush it down the toilet or pour it into a drain unless directed to do so. Instead, consult your pharmacist or local waste disposal company for proper disposal methods. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.